From the first steps of our lecture, I would like to tell you about the first classification of age-related stages. It was written in 1847 by Professor Stepan Fomich Khatevitsky. Stepan Fomich Khatevitsky was a professor of the Saint Vladimir University, now the National Shevchenko University, and he considered that childhood comprises three periods. The first period, or infancy, ranged from the birth to the first eruption of the teeth, covering since 30 40 weeks since the birth of the child. The second period or childhood itself range from the first eruption of the teeth to the change of dental sets at the age of 7-8 years upon the birth, and the third period or adolescence ranged from the change of dental set to the puberty at the age of 14, 16 years old. And now we use the modern classification of the childhood, and all childhood period subdivided into two big periods: the antenatal or stages, antenatal stage or antenatal period, and it exceeds more nearby 270 280 days, and postnatal stage exceeding the period from the birth until 17, 18, and 20 years. And antenatal stage also subdivided into two big groups: the phase of the embryonic development from the conception until 2 months or 8 weeks of the pregnancy, and the phase of placenta development from the third month of prenatal development until the birth, so nearby 40 weeks or 9 months. And postnatal stage also subdivided into several periods. The first newborn period, or we call it neonatal period, from the birth to the age of 1 month, and this period is subdivided into two sub-periods: early neonatal period, the first 7 days, and late neonatal period from the 8th day till 8 days. The period of breastfeeding, the next period of the postnatal stage, or we call it infancy, from the 1 month to 1 year. Then the period of deciduous teeth from 1 year till 7 years, and it's subdivided also in two sub-periods: preschool age, or we call these children toddlers, from 1 year till 3 years, and preschool age from 3 years till 6-7 years, and junior school period from 6-7 years till 11 years. In next, the last postnatal stage is the senior school period from 11 years till 18, 17, 18, and 20 years. But in some countries, the last period is named also adolescence. So, adolescence or senior school period subdivided into several groups: prepubescent period, pubescent period, and post-pubescent period. Um, each period is characterized by the peculiar features. The most prominent features of the antenatal stage are following. In the course of embryonic development, the external parts of the body and the internal organs are formed And in the course of placenta development, the tissues comprising the organs of the fetus are differentiated. This stage is characterized by extremely increment of mass and length of the fetus, and a functional activity of a thyroid gland predominates. You have to know that the developing fetus is highly susceptible to the teratogenic factors, and exposure adverse factors in the phase of embryonic development may result in embryopathies and representing the gross anatomical abnormalities. And exposure to the adverse factor within the phase of placenta development, the delay in growth and differentiation, like hypoplasia, as well as the disorders of differentiation dysplasia, are quite possible. So, embryopathy is known as a whole set of the fetal alteration upon exposure to the adverse factor within the phase of embryonic development. And on this picture, you can see the example of diabetic embryopathy. Child was born from the mother with diabetes mellitus, and you can see the midline facial defect, facial macrosomia, and anotia. Example of the embryopathy can be Warfarin syndrome or Coumarin syndrome. It's a constellation of a birth defect when warfarin or other coumarin derivatives is given during the first trimester of the pregnancy, nearby between 6, sometimes 9, sometimes 12 weeks of pregnancy, and it leads to fetal warfarin syndrome. And you can see on this picture a boy with embryopathy with warfarin syndrome, uh, which comprise fetal bone and cartilages formation abnormalities, facial abnormalities, optic atrophy, digital abnormalities, epithelial changes, and mental retardation. And and the next child also with warfarin embryopathy, you can see that this child has nasal hypoplasia, depressed nasal bridge, flat face, and altered calcification, and also mental retardation. Uh, Fetopathy is known as a whole set of fetal alteration upon exposure to the adverse factor within the phase of placenta development.
Ну, кого я там сразу.
What? Do you hear me? Do you hear me?
Yes, no.
Да,
Uh,
чуємо вас.
And example of alcohol fetopathy, example of fetopathy can be alcohol fetopathy. Describes the spectrum of birth defect syndromes caused by maternal consumption of alcohol during the pregnancy. And on this picture, you can see the child with alcohol fetopathy. So this child has brain damage, which accompanied with facial stigmata. And also the same picture with alcohol fetopathy, and symptoms of alcohol fetopathy. In face, you can see a smooth philtrum and thin upper lip. And the child was born, and newborn period starts from the moment of birth, and duration of this period amounts to 1 month. And the most peculiar features of the newborn period are the following. Pulmonary circulation and lung respiration are becoming functional. A feeding shift to the internal enteral part type. A newborn baby period is characterized by the morphologic incompleteness and functional imperfection of the most organs and systems of the body. Um, the exhibition in the cerebral cortex predominates over excitation. So at this period, child mostly sleep, and the sleep period lasts more than 22 hours. Among the glands of internal secretion, the adrenal and the thyroid predominate functionally. Immune system of the newborn baby is imperfect. And several words about diseases. In newborn period, we can see embryopathies and fetopathies. We can see injuries in the course of delivery and chromosomal abnormalities in the and infections, different infectious diseases. They can be acquired or congenital. Uh, and the most prevalent diseases coupled with chromosomal abnormalities during the newborn period are Down syndrome, Shereshevsky-Turner syndrome, and Klinefelter syndrome. And on this picture, you can see the child with Down syndrome, with intellectual disability, weak muscle tone, cardiac problem. It can be abnormalities of the heart and problems with digestive system. Very often happened gastroesophageal reflux diseases and underactive thyroid gland. The next picture with the girl with Shereshevsky-Turner syndrome. Shereshevsky-Turner syndrome affects only females. These children, as a rule, started growth, no puberty. Uh, they have only one X chromosome and infertility. Also, the child with Shereshevsky-Turner syndrome, they have lymphedema, low hairline, low set ears, reproductive sterility. And Klinefelter syndrome there is a chromosomal condition that only affects males. For men with Klinefelter syndrome, chromosome arrangement is 47 double XY. And on this picture, you can see the boy or man with Klinefelter syndrome, and you can see gynecomastia, lack of the hair on the body, testicular atrophy, infertility, and long extremities. And child with Klinefelter syndrome sit up, crawl, and walk later than other infants, weaker muscles, and um, when they entering puberty, they are infertility. The congenital disorders caused by enzyme loss or deficiency are such as follows. Phenylketonuria, the lack or inactivity of phenylalanine hydroxylase enzyme, alkaptonuria, the disordered metabolism of phenylalanine and tyrosine enzyme, and albinism and others. Uh, The most prevalent congenital abnormalities in newborn period are such as following: the congenital heart abnormalities, pillar stenosis, congenital hydrocephaly, and congenital defects of maxillofacial area. We can see the hair lip, cleft palate, and congenital defect of the tongue, uh, congenital defects of the nose, frenulum attachment, and disproportions of the jaws and others. And on this picture, you can see the cleft palate, and on the right picture, and the left picture, and on the right picture, you can see cleft lip, cleft lip. What happened?
Здравствуйте.
And cleft palate. The next congenital defects of the nose. All these defects need operation. And disproportions of the jaw also is a congenital abnormalities what happens in newborn period. Intranatal injuries. First of all, intranatal tumor. This is edema of the soft tissue of the child's head as a result of the venous stasis in the course of passage through the parturient canal. Then cephalohematoma, intracranial injuries, and the bone fractures and injuries of the peripheral nerves. On this picture, you can see the clavicular fracture and fracture of the cranium. Here you can see also. And infections. They can be congenital infections and acquired. And the group of congenital infections or intrauterine infections we call torch infections. T. Toxoplasmosis, R. Rubella, C. Cytomegalovirus, and H. Herpes simplex, and O. Others. Others, it can be congenital syphilis, hepatitis, listeriosis, and others. All of them are examples of congenital infections. And one of the diagnostic criteria of intrauterine infections consists in umbilical blood immunoglobulin M content exceeds 0.2 gram per liter. You have to know that newborn babies have the increased susceptibility to the pyogenic infections caused by staphylococci, streptococci, Escherichia coli, salmonella, and increased susceptibility of the newborn children appears to result from the low phagocytic activity of leukocytes, decreased content of the component of complement system, the low content of immunoglobulin M and local immunity. But you have to know that newborn babies are not susceptible to many acute infections of childhood. And we can explain it by the passive immunity due to transplacental immunoglobulin G transfer from the maternal blood to the blood of the child. The next period is a period of breastfeeding ranged from the age of 1 month to the age of 1 year. At this period, we can see intensive growth and mass as increment, The mass of the body at the age of 5 months is doubled, and at the age of 1 year is tripled as compared to the mass at birth. The length of the body within the 1 year increases by 50% as compared with those at birth. And at this period, we can see the high level of metabolic processes and predominance of functional activity of thyroid gland and thymus we can see at this period. Intensive growth and differentiation of the brain tissue with accompanying morphological and functional imperfection and increased permeability of blood barrier also we can see at this period. And this feature may predispose to the cramps of the functional origin which may accompany the respiratory virus diseases. The functional weakness of digestive system with low activity of enzymes of saliva and gastric juice, resulting in frequent dyspepsia, and the intensive growth of locomotor system facilitating the development of reflux at this period. The insufficiency in development of auxiliary nasal sinuses, which may explain the fact of absence of geniarthritis and polysinusitis in this period, and the decrease in passive immunity, at the age of 4 months is evident, and this feature predisposes to pyogenic and other infections. And the intensive develop at this period, we can see the intensive development of numerous condition reflexes with formation as a second signal system, so speech, and at 1 year, a child usually knows 10 words. The next period is a period of deciduous teeth. It lasts from the 1 year till 6 years, and at this period we can see the improvement of the whole set of functional system. First of all, nervous system finally differentiates. This period is marked by intensive intellectual development with the complication the physical activity. This period is characterized by formation and the development of this second signal system, and pituitary gland and thymus predominant functionally, and propensity to diffuse reaction is diminished, and immune system is upgraded. What is diseases we can see at this period? Uh, Mostly, this is an acute childhood infection like measles, scarlet fever, chickenpox, and other. Uh, Very often, the acute respiratory viral infections and others infections or diseases of respiratory system. And um, next period, the junior school period, it ranged from the 6, 7 to 11 years. At this period, we can see the morphological differentiation of the brain, the steady state equilibrium between excitation and inhibition, and the cortex prevail over subcortical area and its vegetative function. At this period, we can see the considerable increase in the mass of the muscles and hormones of thyroid and gonads prevail. Uh, about diseases at the junior school period. Mostly this is acquired chronic heart diseases like acute rheumatic fever, myocarditis, endocarditis, and other. Acquired diseases of connective tissue, um, the chronic diseases of kidney like pyelonephritis and glomerulonephritis, allergic diseases, bronchial asthma, and diseases of nervous system, disorders of the posture, and pathology of the organs of vision. And on the picture you can see the boy age 10 years old um, with juvenile dermatomyositis. He was treated, his condition was very severe. He was treated at the Institute of Pediatric Obstetric and Gynecology, but with good effect. And the disorder of the posture, so you can see the kyphosis of this child. And the last period, the senior school period, begins at the age of 11, but the exact term of pubescence are varied individuality. In girls, the pubescence as a rule occurs at the age 11-16. In some girls from 9 years, while in boys at the age 11-13 till 18-20 years. And pubertal period is accompanied by the shift in the endocrine system with the predominance of the functional activity of gonads. Um, at this period, we can see the secondary sexual features. In girls, the growth of the breasts, the menses, the growth of pubic and axillary hair, and in boys, the change of the voice, the beginning of pollution, the growth of the hair practically all over the body. And proportions of the body and the functional properties of the organs and systems of the body acquired the features characteristic of those in adults. And this period is accompanied by extensive psychological development and character, and the individuality of the teenagers are formed in the pubertal period. Several words about diseases. Uh, at this period, we can see psychoneurosis, functional disorders of cardiac activity. We can see endocrine dysfunction, sexual dysfunction, diseases of digestive system, and pathology of the skeletal system. On this picture, you can see dental caries of the teeth, also dental caries of the teeth, disorders of the skeletal system, psoriatic scoliosis, and disorder of the spine. This is a kyphosis, the spine with kyphosis, and this is right picture normal normal structure of the spine. And that is all what I would like to tell you. Thank you for your attention. Goodbye.
Good.
चालीस 50 मिनट होगा. हेलो हेलो.
I'd like to tell you that you will have another lecture in several minutes. You have to wait your lecture because it will be another lecture. It will be vice professor of our department, Anastasia Gorobets. She will read you another lecture. Thank you for your attention.